Obamacare was designed to provide coverage to the 50 million uninsured Americans. The second thing was to pay for it with some significant some budget cuts in the Medicare system, which is the government program for the elderly. And there were also some influence on the government program for the poor. And then finally, inside Obamacare was some incentives to create new structures. So organizing hospitals and physicians into accountable care organizations, and also supporting the theme of this conference, which is patient-centered primary care. So those are the three main things that were sort of inherent in Obamacare. Most healthcare reform is designed to improve coverage as well as reduce costs. So when you reduce costs, unfortunately, the money is coming from somewhere. And so typically we see a lot of resistance from the providers, because they're the ones that are typically most affected. So if you're a physician or you're a hospital and you see a decrease in your revenue or compensation, you know, they're most likely. The other obstacle, I think, is really the awareness of what you're trying to do. You know, most people in America are not really aware of the costs of healthcare and those kinds of things, and they like freedom of choice. And healthcare reform is going to affect both of those. It's going to potentially reduce the cost and also potentially limit the choice. So so the providers and the consumers are typically, you know, one of the major obstacles. As I go around the country, I see lots of hospitals and physicians getting together to form these accountable care organizations. And with it, they are trying to change the practice. So they are trying to be more primary care centered. So in many cases, they are hiring primary care physicians or primary care physician groups. They are bringing in electronic medical records so that everybody gets to use the same medical records. So I really see that as a catalyst for support of patient-centered primary care. The challenges are we need to get consumers to be more healthy and more aware of how their lifestyle impacts their health. And then we need to get providers to be more organized around what the market needs as opposed to what they need. There's a mismatch between what providers are going to deliver and what consumers want.